Welcome back to Your Health in Your Hands. We've been talking about cardiovascular disease. In the last session, we talked about high blood pressure and why that's a problem. In this session, we're going to be talking about an interesting, interesting topic. And when I mention this, most people are shocked. And I got to tell you, I was shocked. I was a little surprised about it myself. Your teeth, the relationship between your dental hygiene and your cardiovascular health. Specifically the health of your endothelium, like we've always talked about. Remember, the primary cause of cardiovascular disease is a damage to the lining of the blood vessel. And so we're going to show you how dental hygiene can relate to that. Now, here's a quote I just want to quickly read out on your screen. People with gum disease, also known as periodontal disease, have think about that, 2 to 3 times the risk of having a heart attack, stroke, or other serious cardiovascular events. Have you heard that before? I hadn't until a while back myself. Why is that so? Well, there's an interesting link. And now they're studying that a lot more these days. So this is the mouth. This is the blood vessel, and this is the heart. What they're finding out is that gum disease, so when there's gum disease, we all have bacteria in our teeth and in our gums. So what they're finding out is that the bad bacteria, if the teeth aren't well cleaned, if the gum isn't always taken care of, the bad bacteria tend to multiply. They tend to grow, they tend to cause a lot of problems in the teeth. But it doesn't just stay there. So your dentist might look at the plaques and try to address the plaques. What they find out is that the bad bacteria jump into the bloodstream and actually have a predilection for the lining of those arteries, and sometimes even get into the heart too and have infections in the heart. That's a lot rarer, but for the most part, they address or they affect the lining of the arteries. And they can actually begin to cause what is known as inflammation. And that inflammation will begin to cause, again, back to that word again, jaga jaga, on the inner lining of the blood vessels. And again, the process continues, it continues and continues and continues until you have a blockage. I know this sounds strange. If you go online, if you Google it, if you talk to your dentist about it, your dentist certainly knows about it. You will see that it actually does cause that. And there are specific bacteria and viruses that are specifically involved in that. So what they know now is that bad gums, bad teeth, bad bacteria in your gums, in your teeth, can actually cause things like premature labor, premature births. They can actually cause brain disorders. They can actually increase the rate of dementia. They can, obviously, they can cause bad breath, and they can cause even lung disease. So again, you don't want to play around with gum disease at all. And you see some slides and pictures in front of you. There's a direct correlation. I can't overemphasize this enough. There's a direct correlation between good teeth, gum disease, dental hygiene, and cardiovascular health. Here's another quote. Daily brushing and flossing can prevent and even reverse an early stage of gum disease, known as gingivitis. If your dentist says you have gingivitis, ask for a brushing and flossing demonstration to make sure you are doing both correctly, says a doctor. Many people don't spend enough time or care when brushing their teeth. The recommended time is 2 minutes. Flossing sweeps away the sticky film between the teeth that leads to plaque buildup. Twice daily cleanings by a dentist or hygienist are also advisable. That's another thing that we don't tend to pay much attention to. We don't look at we don't have this regular practice. In the developed world, they do. I mean, it's part of the insurance. You have to go to the dentist twice a year for house cleaning. We may not always all be able to afford it, but the things that you should be able to afford are brush your teeth every night, not just in the morning. Too many people don't do that, even the educated and highly progressive people. So you want to brush your teeth both at night and in the morning, at night after your last meal. Flossing is also important because flossing actually goes in between the teeth and it actually takes out the bacteria. So you have this like stringy things that you can put between your teeth called floss, and you can actually remove it. Pay attention to the health of your teeth. Pay attention to what you put in your mouth. Extremely important. And if you do so, you'll be going a step further towards improving the health of your endothelium and improving your cardiovascular health. So thank you for staying with us. Be sure to go online to give us your comments, send in your questions. We will be on top of things. We will try to get back with you and let you know answer your questions as much as possible, and at least keep in touch with you. This is a very important topic, and I think, and try and invite other people to come and watch these programs as they're airing. Thanks again. This is Dr. David Ajibade. Your health in your hands.